Good afternoon, everyone. It is time for one of these. In fact, it's more than time because it's been a while since I've done one of these data updates. A little bit more longer than usual, but part of the reason for that is I've been sort of confused like everyone else is about exactly what's going to happen. I still don't know much more than I did, but I'm comfortable enough to have picked a model that I think gives us the best chance of knowing what's going to happen going forward. And as you may know, some of the outbreaks that we were watching earlier in this have actually grown since that time. All of the states that we were talking about before have gotten worse. A couple of states have gotten better, but not as many as have gotten worse. When I say gotten worse, notice that also I'm talking about specifically cases and, to a lesser degree, hospitalizations. Deaths have actually improved even in the time to this day where I'm saying this right now. I don't actually expect that to continue. What do I expect to happen and why is the subject of today's talk. So, this is the Seattle Times headline reflects this same sort of question that everyone's asking right now. Coronavirus cases are rising, but deaths are still down. So what do I think is going to happen? I don't think deaths are going to spike up. I also don't think that they will drop down to nothing. So how's a good middle of the road answer to be they will do neither and they will stay roughly flat from here on out, increasing a little bit and then hopefully decreasing over the next couple of months? So the bad news is that the deaths are not going away. The good news is that I think that the fears of a spike are unlikely to happen. Let me say that with all due uncertainty, and I'm going to explain why I think that is the case. So what I expect to happen is I expect us to actually rise a little bit in deaths per day and to have about 750 deaths for the next 2 months. I'm still hoping that this means that this may turn into the second wave, and this means that any third wave in the winter would be even lesser than this. But I'll give my reasons for that in the later parts of it. As usual, I start out with the bad news, and then I'm going to talk about the good news. So, the bad news is that that blue line has gone up. That is daily cases, an easy-to-measure number measured for the U.S. And it's definitely shooting up parallel to the line that it rose before. But we've got to remember that there's a very different circumstance now. We have tripled testing, at least, from the time of that first line. We have to account for that. It's definitely still going up, don't get me wrong. But it's not going up at the same rate that it looks like on this graph because we have to account for the increased testing. The other thing to notice is that deaths rose pretty much a week or two after that initial rise. But we're now past a week or two after the beginning of that rise, and yet deaths are still going down. In fact, I haven't completely checked the numbers for today, but today's a holiday weekend anyways, so the numbers are not going to be projectable from today anyways. Leading up to yesterday, deaths are still down, but now they're only down week over week by like 1 to 10, whereas before they were down week over week by 100 or more. That is a sure sign that the deaths are flattening out, and we should expect this orange line to be flat from here on out. So here is the other piece of data is hospitalizations, and I'm glad to say that COVID tracking project now has national hospitalizations. You've got to keep one thing in mind when looking at those. Here's what I was saying about before about tests having basically more than tripled since early April. Early April we had less than 200,000 tests a day. Now we have more than 600,000 tests a day. So when we were seeing cases going down before, we wanted them to go down more, I actually wasn't that worried about the May decline in cases because we were testing so much more. But now you can see in June we've had something different happening. We have the cases definitely going up. And if you look at the slopes of those lines, yeah, new cases are going up faster than new tests are coming in. There's definitely outbreaks going on. So now COVID tracking has the hospitalizations number. The one important thing to point out about this is current hospitalizations, and you can see cases are going up on the left, deaths are going down on the right, and hospitalizations are splitting the difference in the middle. They're going up, but later and less. this is actually a very helpful measure looking at the hospitalizations for saying, yes, something new is going on now. When I did my last update on June 22nd, we were about at the bottom of that, and I had not seen any increase in hospitalizations yet. Then Arizona, Texas, California, and to a lesser degree, just recently Florida has increased in this level. The other thing about this, current hospitalizations are not reported by 10% of the states. It's a decision that they made early on. I can't talk them out of it. And so Florida doesn't report current hospitalizations. This is without one of our big states that's increasing an outbreak right now. But we can estimate what the Florida contribution to this curve should be. And I'm going to estimate that it's going to be about 3,000 to 4,000 current hospitalizations, worst case scenario for Florida. That means that this blue line would be above the 40,000 line that you see there. But you see it's about a 10% increase at most from what is actually reported here. So I think the shape of the graph is pretty true to form even without Florida. If you want to interpret hospitalizations are up, they are not up as much as they were up. And the question is, how much are they up in different areas? Remember that most of the previous hospitalization peak was driven by northeastern states, and a handful of states, maybe 5 or 6 states, contributed most of that original curve. Now we have 5 to 6 states that are more populous overall when you add them together, I believe, and they are driving this second curve. The second curve is not yet like the first, and I think there's signs that it won't be exactly like the first. It won't be as bad, is what I am hoping. So how do we account for Florida? Florida does account new hospitalized patients every day. They just don't tell you how long they stay in the hospital. And so we can take the numbers from early on in the epidemic that the hospital stays were 10 days in median, 10 to 13 days in median. So, and I have weekly new hospitalizations, what I do to sort of smooth out the curve. So it's actually a pretty simple calculation. You just take all the new hospitalizations for the last week, and you assume that all those patients are still in the hospital, and you double it. This, you can say ups and downs about lots of things, but I think that's going to be a minor effect, and this is just an estimate. But if we take the 1,600 number that has been newly hospitalized over the past week, we double it, we get about 3,500 hospitalized patients estimated in Florida right now. And again, that's about 10% of the 40,000 that we see on the COVID tracking page, which means that that blue line should be brought up a little bit, like I said. I'm trying to be pessimistic with this here. And the other thing I want to say about Florida hospitalizations, because I've been tracking them, my last update, I was saying how they were rising and worrying me a little bit. Since the last half week, they have been rising in a way that genuinely worries me. So I am more worried about Florida now. Everything I say, when I say stop picking on Florida, don't think they're hiding data. And I think this data is true. I just think that they are experiencing a true outbreak. And so what do we think will happen next? Hopefully this line will be like the Arizona line and start to decrease less. That's the only piece of good news I can get to you from Arizona today. The Arizona line for the past week has been decreasing less than it was, has been increasing less than it was increasing before. So you've got that going on. The one other thing I want to say, everyone's worried about New York City happening again. And of all the states, there are 4 major outbreaks right now in 4 different states. The Arizona is the closest to being the New York levels of the outbreak. But even taking the numbers for New York State as a state overall, which is, I believe, not as accurate as it would be taking it for the city, but that would inflate the numbers in my view. So let's just take the states because we're comparing states right now. And let's say at the peak of New York's worst part of the epidemic, how many people were hospitalized per million people in the state? It comes out to be a pretty easy number to calculate. 1,000 people per million were hospitalized at the peak of New York State. So let's look at the numbers right now and let's normalize it to the population. And you can see that Arizona has 430 people hospitalized per million. And that is almost half of what New York State was at the peak. So Arizona is moving up towards, and it looks like they've got the momentum to definitely be moving up to being a true half of what New York City was at the peak. I'm hoping, and there's signs that it might be able to turn around at that point. We'll have to definitely keep an eye on that. And Arizona is the worst hit state proportionally right now. Texas and Florida, as bad as they are, population-wise, and looking at it statewide, are actually half as bad as Arizona is right now, which is bad. Don't get me wrong. But also it's 1/4 as bad as New York City was at its peak. And I should say New York State, not New York City. California right now is actually a little bit better than those other ones as well. Locally, these reflect local outbreaks that are going to be worse in certain cities. Houston, Phoenix. The different cities are going to each have their own challenges. And so there's definitely true that there are hospitals in Florida that are full. But also realize this isn't like an inelastic number. There are ways that the health system is stressed, but so far we saw New York endure a stress that is twice what Arizona is seeing right now. I want that to turn around as soon as possible. But we've got to put this in perspective. This is why I'm saying that this current increase is not yet like the first increase. And it's possible that it will be more mild overall. These systems are stressed, and we better pray that Arizona turns around soon. We better pray that Texas slows down soon. And like I said, I see some things in the data. Arizona might be slowing down on a week-by-week basis, but that means slowing down its increase. We need to get that number going down. So my question is, what's going to happen next? And everybody's got an idea. I want to take the baseline as nothing new is going to happen that hasn't already happened with, say, New York City. And so I want to find a data-based model that's not based on that's based on stuff that we've figured out since this has started. That means empirically looking at what's going on with the different states and trying to put them together, have the computer help us put them together to predict what's going to go on, and have an iterative loop where you predict what's going to happen, you see if it happened, and then you keep the parts of the model that made it happen that way. And then you test it again. You test your models. And this is one thing, the previous model that I used, IHME, doesn't really test their models. And it looks to me like they're making up a lot of stuff as they go along. So I want to drop them as a model, and I want to go to another modeler. This is C19 Pro at covid-projections.com. And I've said this before because I mentioned this on my last data update, as I liked this model. And since that time, this model has predicted exactly what's going on with the death count. And this is what the tweet from the doctor who runs the model is going to say about this. And by doctor, I mean I assume that he has a doctorate in data analytics, not medical doctor. But that's what I want. I want to see where is the data pointing us. And so this is what I showed you last time, June 22. This is what we saw for deaths per day. And last time I said, don't be surprised if the deaths flatten out at this point. In fact, if you look at the little divot in that line, it's right around July 1st. That's where we are right now. This is from this morning. These are the projections. The other thing I want you to point out, look at another couple of the numbers on top. Projected total of deaths between 180,000 and 200,000. And that's been pretty steady, even with the extra cases that we've seen. It looks like this model is pretty robust to what we've seen lately, and it's incorporating the new information. The other thing to notice, total infected. According to this model, one of the things I like about this is it tries to show us the invisible infections, because we know there's a ton of asymptomatic infections. There's a ton of infections that don't get caught by the testing apparatus. So how many percent of Americans have caught this disease? It looks like 6.1%, and I actually think that's a good number from all the models that I've looked at. So if you look at that model, it predicts 750 plus or minus per day through September. The upper bound of that is actually close to 1,500, so that could be doubled. But from what I've seen, this model is actually pretty good, so I expect it to be between 500 and 1,000 for the rest of the days. If you're looking at any one day of data, 500 to 1,000 for that day of data is pretty much what this is predicting. If it goes above 1,000, then I'd say that this model is verging on wrong. But I haven't seen that happen yet, and it's been pretty well trained so far. So notice that the 750 per day, if that happens, that is 1/3 of what we saw before, less than 1/3, maybe 1/4 of the peaks that we saw before of 2.5 thousand, 2,500 deaths a day. You know, do you want to call that good news or bad news? It's definitely better because it predicts that we won't see something on the scale of what we saw in New York City, because the medical system can't handle that. I would love to see this model prove wrong on the downside. But if you ask me what I think is going to happen, we should be ready for this. This is what I predicted on June 22, and by the way, again, one of the hardest things is predicting how many invisible cases are we seeing. And this was the prediction on June 22 for the number of cases total, whether tested for or not. And they were predicting that the cases would come up and be plateaued around 50% of the peak. But notice that the uncertainty goes up to about where the dotted line is now. This is the current prediction for cases, roughly, that this is predicting. And you see now is predicting that we'll have as many cases in the second part of this as we did in the first. And that's my criterion for saying, okay, it looks like we should call this a second wave. It's a big country, and the wave is bouncing around. The other piece of good news that I can see is that this is not coming back to where it's hit hard before. These are all hitting new places and bringing them up on the curve. And actually, this model breaks it down state by state and even county by county in some places. So let's take a look at what the local predictions are now that we've talked about the national predictions. I showed this on June 22 for the predictions of this model for Arizona. And you can see, let's go back and forth. This is the July 4 predictions. You can see that they're up a little bit, but it's not predicting that there's going to be a huge spike in Arizona. The deaths per day look like they're going to be around 50, if this model is right. The other thing I want to point out, though, is notice how much bigger the cases line is. This is predicting that a lot more people are going to get infected. So again, we're seeing a lot more cases, but the proportion of cases that result in the outcome of death has gone down. That's another piece of good news that I can give to you. It looks like that is real. The infection fatality rate appears to be genuinely dropping. Better medical care, everything goes into that. But younger people getting the disease, you know, all that goes into it. This is just an average over the entire country. But the one thing I want to point out is, look at that number. Total infected is now 8.3%. It says that 8.3% of the Arizona state has been infected. Now, this disease has momentum, but it is continuing to predict this momentum will go down. And that's from being trained on all the other states that have gone before. I think that that has a good chance of happening. And so the good news is Arizona hopefully will start going down soon. This goes along with the decrease in the rate of increase in the hospitalizations. And this is predicting maybe by mid-July, we might actually see hospitalizations genuinely start to drop in Arizona. Let's hope. The New York City, one of the questions is how many people got it in New York City? So many people died in New York City, almost 1,000 per day in the middle of this in April. Don't forget those numbers, the scale of what happened in New York City. And so this model accounts for all that, and it predicts that there's not going to be a big burst of deaths coming up in New York City because 25% of the populace has already been infected. Now, maybe there's some long-term part of this virus where it can come back, but this is what this model is predicting. So let's keep this eye on this part of the model. Will the disease come back to where it's been before? It's possible that it won't. And let me give you some of the immune reasoning behind that. People, don't get me wrong about any of this. I'm just saying, why would the model be predicting something like this? Why would something like this be what we are observing? I'm not saying that if you're in Arizona that you don't need to worry. I've just shown you the reasons to worry in Arizona. So let's move from New York State. Oh, and I want to mention about New York City, total infected, 25.6%. So it looks like this is predicting about a quarter to a third of the people in an area can be infected, and then the disease is not coming back. Now again, we haven't seen an area that looks like this yet, so we're not completely sure what's going to happen. But there is a possibility that this could happen. Washington, you have the basically it's a flat death rate from here on out. It predicts that newly infected people cases will increase a little bit, and actually on the upper end, with all the uncertainty, there could be some kind of outbreak that takes hold. The fact of the matter is, outbreaks are going to take hold, and it's going to look random to us. We can't necessarily predict whether Washington is going to have 10,000 cases, people infected, or 1,000 people infected in a month. But we can say that it doesn't look like we're going to have 100,000 people infected in a month. I think that that's what this model is saying. Total infected, about 3% right now. It's on the low end. King County, more of King County is infected. You see it's up to 4.1%. And therefore, the deaths stay down more in King County as opposed to the counties that have been hit less in eastern Washington. The good news is also this means hospitalizations should stay at the same low level that they are right now. They might increase a little bit as cases increase. But since deaths are not predicted to increase, the hospitalizations, if they stay down to where they are right now, and by the way, they are staying down from all the data that I can collect. It's noisy, and they're bouncing around, and they're still there. But they are staying down. So let's keep an eye on those. I have friends in British Columbia, and they want to know what's going on, what the model predicts for them. The model actually predicts that only 6.6% of people have been infected. So the good news is that it looks like the disease has been kept out of British Columbia. If that continues, then the line's going to stay low. But you see how much uncertainty there is. If there is an introduction of this disease, then it predicts that there is a lot of people that could get infected. You could get newly infected people around 1,000 a day, rather than the low line of around 100 a day that we're seeing right here. This has a lot to do with the history of a place. We don't know yet quite how much it affects what's going on. So the question is moving forward. Could something happen that C19 Pro isn't ready for? C19 Pro does a good job of capturing the past. Could there be some super infective version of the virus evolving that would then cause a spike to happen? I don't know, but I don't think it's very likely. I will explain why I don't think that there will be a big spike up to, getting a huge proportion of the country infected, because there is an arm of the immune system that there's evidence that it's helping us. But I've already gone on long enough in this lecture. I'm going to go on and explain that in the next part. I think the IFR is falling, and that is what comes from the C19 Pro data. The case fatality rate is down. I don't have the evidence for this, but I saw a graph today that convinced me. The case fatality rate was 6% early on in the disease. I believe it's down to 2% now, averaged over all cases that we catch. I think the IFR likewise is also dropping, and it's down from what was 1% before, and I've said 0.7% before, and now looking at these data, I think it's dropped even further. And it seems reasonable to expect from a quick back-of-the-envelope calculation that it's down to 0.4%. This is actually important, because the IFR and the R0 are the two numbers that we can measure and control that tell us how to react for the virus. If the IFR is improving, that means that we are saving lives. And that means we have to think about what kind of non-pharmaceutical interventions we need to have to keep the R0 low, to keep the IFR down. But it's already come down, which is good news. So my question is, what if this model is right? Everyone's asking what's going to happen if New York City happens again. And I want to ask the question of, this model that I trust is saying that deaths are going to be flat going on out. What does that mean? Because that is a huge number of people. It'd be great if we could eliminate that. What if we can't eliminate those deaths? And what if there's other considerations that we have to do? And a lot of people say that that's a lot of people don't like to talk about that, but we have to look at this as excess deaths and things like that. I've made all these arguments before, and I'm trying to look at this as a scientist to say we have this thing that we want to stop, this virus that we want to stop, and there are levers that we can pull to stop it. Which levers should we pull? But each of those levers has a cost. We can't just say we pull every lever, honestly. This is a much bigger argument than I have time to get into today. So I'm going to say, put that argument aside. Let's say that this model that's been shown right for the last couple months continues to be right. 750 deaths a day, and that number doesn't budge. What do we do about it? So that's the question I have for you going forward. So think about that. Thanks for listening, and I am going to, that's the bad news, but I'm going to go and I'm going to tell you a bit of good news in a couple of more things coming up about some research that I've actually done on this area. And so you can put that off, though. I want you to separate the July 4th specific information from the other information, which I hope will be longer lasting.